I do think that having a nice environment, a welcoming environment, is key when going to the doctor. I think that the doctor's office and the staff, we're here to provide a comfortable environment. We're here for you. We're here for this journey, and we know that coming to the doctor puts us in a very vulnerable state, and we appreciate that, and we want you to make sure that you're comfortable, and we want to be here for you. We are here for you.
My heart's desire is to see that my patients are free from anxiety. An anxious patient is someone who always gets my heart, because I want them to be at peace. I want them to be comfortable with what we're going to be doing for them. And more than anything, that they know where their healing comes from, and that they're confident and have realistic expectations of their future after surgery and what that might look like.
We are very fortunate to have here at Alamance Regional a Center of Excellence robotic program, which that means that an institution, an accredited body, has vetted us about what we do. We've been doing robotic surgery for a while, so close to 6 years on my case. And that technology has benefited our patients because we're able to do more surgeries in a more minimally invasive ways without compromising the safety and without having to be more invasive.
It's a new technology that we can offer patients. Although I knew how to do the surgeries that I do now laparoscopically or open if needed, with the robotic technology, I feel like we're able to do those same surgeries that potentially could even be more complex with a platform that allows us to do things more easily, even for those complex cases.
You know, the robot has really made a huge difference in how we practice in patient outcomes as well here. And I believe we are the first surgical center of excellence in robotics in North Carolina. So for the residents of Alamance County and surrounding areas, I feel like that is a huge benefit, a huge resource to take advantage of.
Robotics really plays an instrumental role in getting people back to their normal activities in a faster way, faster recovery. That is very important to us.
And so from that standpoint, I'm able to see things better. I'm able to move inside the abdomen better, and do sort of more fine movements and cuts and move things around more easily with this new technology.
What I love most about our group is that diversity of all the different surgeons, right? So we bring different experiences, different training, certainly different ages to our patients, one that reflects our patients.
Some of the most rewarding is some of the things we do most commonly, like acute appendicitis, acute gallbladder issues, patients who are truly experiencing pain and can appreciate a life-changing difference just overnight.
I think a lot of patients are very scared and anxious about surgery, particularly about the pain of surgery. So I always tell them that we're going to control your pain, okay, and we're going to make this make you feel okay and make you feel better. I think that's important for them.
I think surgery in itself, whether big or small, carries risks, it carries unknowns, it carries uncertainties, and I think that's the biggest thing to address with patients is, making sure they know, hey, what does before surgery look like? What are we going to do when we're there, and what's it going to look like for you after?